EMS has a new tool to help save lives. Find out what happens when you call 911, learn what you can do to improve our air quality, and the halls of government are now colored. All this and more on Metro Edition. Hi everyone, welcome to this Metro Edition. I'm Matt Schuster. Athletes took to the river and the streets here in Louisville recently for the Ironman Triathlon. Behind the scenes, Louisville Metro EMS crews were ready to handle any medical emergency. Mayor Jerry Abramson and EMS Director Dr. Neil Richmond unveiled a new tool for EMS crews to use at events just like this one.
Louisville unveiled its newest tool for improved emergency medical response. RESCU, or Regional Emergency Services Care Unit, is a mobile emergency room that can be deployed at disaster scenes or major public events to begin treatment of patients on site and reduce the number of patients sent to hospital emergency rooms. RESCU is a portable tent inflatable in less than 7 minutes and can accommodate 20 patients at a time. Inside, the tent stores emergency medical supplies and equipment such as cardiac monitors, medications, and intravenous fluid setups, heating and air conditioning units, and privacy curtains. RESCU can be stored and transported in a single ambulance.
Think just how much faster we'll be able to reach those in need of medical care. And we know that emergencies have no boundaries, and that's why the emergency preparedness effort in our MetroSafe communication system crosses county lines. And we are really pleased that the RESCU facility behind me will be part of a regional emergency planning effort.
Recently, Louisville was named a national model by the Centers for Disease Control for establishing strong cooperation between public health agencies and emergency care providers.
What we've learned from events like 911 and Katrina is that a hunkered down bunker mentality just doesn't cut it anymore. Our approach has to be one that emphasizes local preparedness, but also builds regional infrastructures and strong collaborations.
The city plans to make RESCU available for large public events like Thunder over Louisville, the Kentucky Derby, and the Ryder Cup.
EMS crews are ready and available every day here in Louisville to help out in case of an emergency. Have you ever wondered what happens when you call 911? We take an inside look to answer that question and more.
When you call 911 for a friend or family member in a medical emergency, it can be a frightening experience. Tensions are running high and every minute counts. Would you know what to do in that situation? Do you know what to expect when you call 911 for an ambulance? It's important to be familiar with this process. After all, your call can help Louisville Metro EMS, EMTs, and paramedics save time and lives.
40-year-old male, unconscious.
Every citizen should know when to call 911 in a medical emergency. If you've suffered a minor injury or you have a common illness like a cold, you probably don't need our assistance. That means we can stay on the streets for someone who desperately needs emergency attention. But if your symptoms are serious, don't wait. Call 911 first.
MetroSafe Police Fire EMS, operator here.
For example, if you're experiencing chest pain, especially if it's moving down your arms, up into your neck, your jaw or your back, if you're having shortness of breath, nausea or sweating, you could be having a heart attack, and you should call 911 right away.
If you're experiencing numbness or weakness in your arm or leg on one side of your body, or if you have a sudden severe headache, blurred vision, or slurring your speech, you could be having a stroke, and someone should call 911 immediately.
When you dial 911, your call will go to the MetroSafe Communication Center.
911 here. What's the address your emergency?
There, call takers will ask you a series of very important questions about your emergency.
Can you tell if her lips are changing blue or anything?
With the help of special computer software, the call takers will use your answers to determine what type of help you need.
The run will pop up as it did, and then once we click on it, another screen will come up and it will give us a description of what's going on with the patient. And then we select our units to dispatch them and just call for them over the radio. give them all the information they need and hold them responding. On the rundown, it just says right here medic or tech, and it has the name underneath it.
While it may seem like the call taker is asking a lot of questions, it's important that you try to answer them the best you can. Your answers will help the call taker determine who to send to your emergency.
And you can't tell them everything's going to be okay because you don't know if everything's going to be okay. All you can do is just reassure them what they're doing right now is good, keep it up, we're doing the best we can, and reassure them that helps on the way.
Most medical emergencies can be handled by one of our trained emergency medical technicians, but sometimes a more serious medical emergency means you need a paramedic, like me.
115 available at 12:48. 211 you can go to normal. 12:48.
The 911 call takers will also help to determine how quickly the EMS crew needs to arrive at the scene of your emergency. If your medical emergency is non-life-threatening, our ambulance crew will make a Code 1 response, meaning no lights and sirens. However, if your emergency is of a serious, life-threatening nature, we'll respond as quickly as possible with lights and sirens activated. This is known as a Code 3 response, and it's only used when absolutely necessary, so we can protect our crews and other motorists. If you see an ambulance responding with lights and sirens to a medical emergency, be sure to pull your vehicle over to the right side of the road as soon as you can safely do so, to allow the ambulance to pass by quickly.
Okay, is she completely awake and alert?
Some of the questions the call taker may ask you when you call 911 include, what's the address of your emergency? Be as specific as possible. If you're in an apartment, say so. If there's an entrance that's closer to your emergency than the building's main entrance, let us know that as well. What is the phone number from which you're calling? What happened? What was the patient doing when he or she became ill or injured? How many people are hurt or sick? Are you with the patient now? How old is the patient? Is he or she breathing? Is the patient conscious? Call takers will offer instructions for you to follow in order to help the patient while you're waiting for the ambulance to arrive. They may even ask you to help the patient breathe or get their heart started by beginning CPR.
Well, we do have paramedics on the way.
Once you've answered all the call taker's questions, a MetroSafe dispatcher will send out an EMS crew to assist you. The type of crew we send depends on the nature of your emergency. We might send an ambulance with 2 EMTs, or it could be a combination of EMT and paramedic. Also, the dispatcher may feel the need to send one of our rapid response flight cars with a single paramedic. Either way, you can rest assured that the ambulance crew you're getting is fully trained and capable to handle your emergency.
While you're waiting for EMS to arrive, there are steps that you can take to help the patient and our emergency crews.
First, be sure to follow any instructions the MetroSafe call taker gives you regarding the patient. In some cases, it may be necessary to perform CPR. If you or someone nearby is trained in CPR, go ahead and start it. If you can, try to clear a path to the patient so our crews can get in and out easily. Remember, we'll be bringing in a large stretcher and lots of medical equipment, so if you can, clear some space so our providers can work on the patient when we arrive. If there are pets in the home, be sure to secure them in another room. It protects not only your pet, but our emergency crews as well. Pets can be very territorial, and if their owner's in trouble, they may not understand that our medical providers are there to help. If you're in a large building, or if your location is difficult to find, try to post someone in a visible location so the crews can be directed to the scene quickly. If it's nighttime and you're calling from a home address, turn on a porch light to alert responders to your location. Be sure your street address is clearly marked and located in a highly visible location on your home so our crews know when they've found the right place. Gather together any medications the patient is taking at the time. That will help our responders and doctors at the hospital treat the patient.
Once we arrive at the patient's side, our personnel will assess the situation. Normally, we first check a patient's vital signs. In some cases, we may need to perform CPR or use a device called an automatic external defibrillator, or AED, to shock a patient's heart back into rhythm.
Stand back.
Our goal is to treat the patient and make sure they are stabilized before transporting them to a hospital for additional treatment.
No one likes the idea of needing emergency assistance, but if an emergency arises, knowing what to do can make all the difference. If you can remember these steps and remain calm, together we can make a better outcome for everyone.
A new local office opens to help you get in touch with Congress, and kids help bring color to the halls of local government. Still to come on this Metro Edition.